Hi guys, it's Sophie from In the Mess. Today we're going to talk to you about hypoglycemia. Hypoglycemia is a problem that commonly affects people who are on insulin for their diabetes, but can also be seen in people taking tablets for their diabetes, and occasionally seen in people without diabetes who are acutely unwell. We would consider someone to be hypoglycemic if their blood glucose was less than 4 millimoles per litre. If in doubt, just remember 4 is the floor and we don't want anyone going lower than that. When someone gets hypoglycemic, they might experience a range of symptoms. You can get autonomic symptoms such as feeling shaky, sweaty, getting palpitations or feeling hungry. You can get neuroglycopenic symptoms where the brain doesn't have its regular supply of sugar, so you start to get confused, you might get speech disturbance, and you can get full-blown seizures and coma as well, although these are late signs. And people might just feel generally unwell. Some patients with diabetes actually lose their hypo-awareness, so they may not get these classic symptoms. So it's important to check people's blood sugar regularly while in hospital, particularly when there have been changes to their diabetic regime or they're acutely unwell. Most of the time, we would check people's blood sugars 4 times a day, once with each meal and once before bed, to look for any high blood sugars or low blood sugars through the day. Once you've identified that your patient has got low blood sugar, you need to work out what to do about it. If someone is fully conscious but just feeling unwell, you can treat them with sugary drinks or with some of the specific glucose treatments. Sugary drinks such as orange juice or full-fat Coke can be used as an easy remedy to hypoglycemia. Some people will also carry something they prefer, such as jelly babies, to get their blood sugar up. If you're going to use some of the glucose replacement methods, you need to give the right amount of these. So for example, you need to give 4 or 5 glucose tablets, 2 tubes of GlucoBoost gel, or you need to give an entire bottle, 60 ml of GlucoJuice. This might seem like quite a lot, but you're trying to give that person 20 grams of sugar, so you need to make sure that they get enough. If we don't give enough sugar the first time, we just have to repeat the treatment anyway because the blood sugar will not come up. Check the patient's blood sugar again in 10 to 15 minutes and make sure that it has come up above 4. If it hasn't, repeat your treatment and check it again. You can do this up to 3 times. If your patient is uncooperative or cannot swallow or is unconscious, you shouldn't give an oral route. While it's easy to remember 50 ml of 50% dextrose, it's actually quite irritating to the veins, so you're better off giving a slightly more dilute amount, such as 75 ml of 20% glucose or 150 ml of 10% glucose. You can also give 1 mg of IM glucagon, but this can sometimes be quite difficult to find in a general ward. It's also not particularly useful if your patient is quite hectic or is suffering from alcohol-induced hypoglycemia, as they won't have the glycogen stores available to use the glucagon. Again, you need to check your patient's blood glucose in 10 to 15 minutes to ensure it's coming up above 4. You can repeat your treatments again another 3 times. If you've tried 3 times to treat your patient's blood glucose, you need to get senior help. If your patient shows any signs of compromise, such as seizures or coma, you need to get immediate help by putting out an emergency call. So once your patient's blood glucose has come up above 4, you need to give them some long-acting carbohydrates. You also want to make sure you give something that doesn't have any fat in it, as fat will impair the absorption of short-acting carbohydrate from the gut. So chocolate isn't ideal for someone suffering hypoglycemia.
64 slices of American cheese.
When we're giving long-acting carbohydrate, there's a couple of options. You can give someone some toast, a sandwich, a couple of biscuits, or if their next meal is due and available, you can just give them that. But it's really important that they get a source of long-acting, slow-release carbohydrate, particularly if you've given glucagon, as they need the glycogen stores to be replenished. For patients who've suffered an in-hospital hypoglycemic episode, you need to seek the advice of the diabetes team. They may need their insulin or oral hypoglycemics adjusted while they're acutely unwell, particularly if they're not eating and drinking as normal. Most of the reasons that people suffer hypoglycemia in hospital are either due to errors in their insulin administration or due to poor carbohydrate intake. Simple things like giving patients a snack before bedtime might be enough to stop morning hypos. For people with diabetes who are nil by mouth or not able to take a normal diet, consider NG feeding, parenteral nutrition, or putting up a sliding scale to maintain their blood sugars. However, once this person returns to eating and drinking normally, get them back on their subcutaneous insulin as soon as you can. It's sometimes tempting to stop their insulin, but this can be really disruptive, so it's currently recommended not to stop people's insulin. Instead, get advice early. In a nutshell, check your patient's blood sugar regularly, and if you find evidence of hypoglycaemia, give short-acting carbohydrates either by mouth or IV. But don't forget something long-acting once the sugars come back up to normal. Don't forget to like and subscribe so you never miss a thing.